Hey guys, welcome to Pinski Dermatology and Cosmetic Surgery. We are about to take you behind the scenes of a live Aerolase treatment. We use this laser for lots of different things, but today we are going to be treating a patient with acne.
Hi everyone, so I'm Kayla, licensed esthetician here at Pinski Dermatology, and we're going to be treating our patient today, like Jessica said, for some acne vulgaris. This is actually caused when we have some clogged sebaceous glands and bacteria in the skin that can produce that P. acnes. Bacteria that you can kind of see, she's a little congested. She's got a little bit more of some hormonal concerns through her lower face, so we're going to be treating lower face today. And this is going to help kill some bacteria. She's going to have no downtime after this treatment. We do want patients to space the treatment very close together, so patients will come back every 1 to 2 weeks. Depending on kind of how she does, some patients will need a few treatments, some will need up to 6 treatments. And again, with acne, she should feel a little bit clearer, but sometimes for your first treatment, you'll actually get a little bit of a purge. And then with subsequent treatments, you'll actually get clearer. So yeah, we're gonna begin our treatment in just a minute. I'm gonna start kind of prepping, and we'll treat again her lower face. We're gonna be using 2 different lenses today to help kill the bacteria, which we'll kind of go through a little bit. So I'm just gonna get prepped, I'll be right back.
So this is our Aerolase laser. We use this for lots of different things. We use it for hair removal for darker skin types. We use it for acne. We can treat mild to severe acne, moderate acne. We can treat very active acne, so even if you have cystic breakouts or big red inflamed lesions, this is actually great, as the heat will help reduce inflammation, help the redness go down, and help prevent future breakouts. Another thing we use this for is photo rejuvenation. So for anyone who's just looking for like anti-aging and has sun damage or like broken capillaries scattered all over, patients can treat that even if they aren't experiencing any breakouts.
Okay, so we're gonna turn on our laser here, and we're gonna actually start on her left cheek. We're gonna kind of work our way down. Sorry if you can't hear me a little bit. And this again is going to also help refine the patient's pores. It's really good for her blackheads. So she's going to get some tightening actually in her pores right here, and then it's going to, like Jessica was saying, calm some of this inflammation. This patient recently had kind of stopped some hormonal medication, and we're just going to kind of help with calming all this redness and inflammation here today. So we're going to actually start with our 6mm lens. And we're going to adjust the energy as needed, see how this patient will start. And you're just going to feel now some hot little pulses, okay? Kind of like right around this orbital bone here. Here we go. How are you doing, okay? Okay, we're just going to go up just a touch. Hot right here.
You feel okay?
Yep.
Warm it up?
little on the lesions. Okay, I'm going to do another pass right here, same area. You doing okay? Mm-hmm. Okay, we're going to do one more pass here. Okay, Laura? Doing good?
You did 3 passes total?
Yeah, 3 passes. I break it up into sections like this because we're actually going to keep getting a little bit more heat in this area to help with some of that bacteria. So this is our last pass in this area. We're going to move on. Tuck your lower lip under. And the laser's just going to adjust for a second. It'll pop right back on. You can just relax for just a minute. It's going to turn off and come back on. How are you doing? Okay? Yeah. Just a little warm? Yeah, just warm. Yep.
So then you'll spot treat her other spots on that same side?
So we're going to keep on just finishing our pass here. I'm going to do a little on her upper lip. She's got a few little breakouts here. And then we're going to continue doing 3 passes here, and then I'm going to finish off with 2 passes here. So we're just kind of building up the heat in her skin. That's going to help kill this bacteria. And some of the rest of these lesions might purge out a little bit for her, and then she's going to feel clearer.
Let's do her, finish up her left side for this video before you start on the right. Mm-hmm.
Well, I have to switch the lens, so I'm going to do all her lesions at once at the end. Okay, so let's keep going. We'll actually just finish her chin, and then we'll just spot treat the left side.
Perfect.
Okay. Okay, some heat again. Here we go. actually start doing some pulses on her lesions here, just because I know it's a little bit lengthier with all the passes that we do. So just to show you guys, we're gonna switch to our other lens.
For those first few passes, for the settings, would you say she was like high, medium, low, average?
She was average for that. So for her first time, that's exactly where we want her to be. But she was definitely at the perfect energy for her starting point, and she did very well. You could tell just a little bit hotter in a couple of her lesions. We also pulsed over some little areas with scarring. This will actually help build some collagen from the dermal layer, and she'll notice that her pores will look smoother and overall her texture will look smoother as well. So now we are going to spot treat, and we're going to turn down the energy a little bit.
So this is just like a more focused treatment?
So this is a more focused, yes, more focused lens, which has more focused energy. So we actually reduce the energy a little bit here, and we're going to do a couple stacked pulses on some of these little lesions, and it's also good for some of this PAH that she has here. So actually on the PAH, I'm just going to do a quick pulse. You're just going to feel one hot pulse of energy, okay? Here we go, one hot pulse. Good. So a few pulses here. She's actually got a couple little vessels here that we're actually going to spot treat. These right here, Laura, are going to be a couple even hotter pulses, okay? There you go. I know, it's hot there. Good job. One more up here. Pull down your upper lip a little bit. Good. Good job. Okay, for the sake of time today, we're going to conclude that with our Aerolase demo. Thank you to our model for allowing us to film her. And tonight, she'll actually kind of just start to feel, some patients will feel a little bit clearer right away. Otherwise, tomorrow she might feel like some of these kind of finished purging out. But she handled it beautifully. You can see minimal little bit of pinkness, no downtime she'll leave here with, which is awesome because no patients want to have downtime, be able to resume normal activities. I would say today she should just kind of let her skin just remain kind of clean. She can start putting makeup on tomorrow. She can resume exercise tomorrow. So it's a very easy procedure. And overall, what would you say with kind of like the heat?
I thought it was totally tolerable. Felt kind of good.
Good. All right. Well, thank you for joining us today, and we will see you next time.
All right, guys, thanks for watching. So again, that was our Aerolase treatment for acne. If you are struggling with acne or any other skin issues, feel free to contact us and we'll get you scheduled for a consultation and see what treatment might be best for you. Thanks.